Hip dysplasia is a really common talking point in pediatrics. I want you to understand exactly what we're talking about. This here is a terrible drawing that I made of a normal hip. This is where the hip sits in the pelvis. This here is the top of the thigh bone or the femur. And you can see how it articulates or meets and sits in this beautiful cup really nicely. Well, babies are born with a very immature cup. So you can see here that this part is not yet fully developed. And this is absolutely normal. But over time, this becomes closer and closer and pinches into this point and resembles a completely normal hip. So when we look at hip ultrasounds, we're actually ultrasounding this part and seeing how much of the surface of the socket is holding on to the ball of the thigh bone. Now, hip dysplasia is where this stops developing and becomes what we call immature. Some of the risk factors for hip dysplasia include a family history, being firstborn, female, specifically first degree relative in terms of family history, a history of being breech during pregnancy, even if you're not delivering breech. It can be a developmental problem caused by improper swaddling or a neuromuscular or connective tissue condition that is associated with this. If you're worried about your baby, if your baby has one of these, comment hips and I'll send you my hip dysplasia blog so you can learn more.